2017, HB 6887, an act concerning mental health care services and substance abuse services provided by certified peer counselors, was introduced by the Insurance and Real Estate Committee. Opposition to this bill from the peer community was led by Advocacy Unlimited. Concerns over the bill and the language used to define peer support and how much latitude it gives to insurance companies to determine what actually counts as peer support. Another concern was requiring insurance companies, provider networks, and hospital associations to define peer support service. It will become another business transaction. It was said that when this becomes purely a business transaction, the effectiveness of this particular support service will be diminished. Thankfully, the bill failed to pass. One thing this 2017 legislative session did do was start a conversation among some peers in the community. We talked about the possibilities of being able to not only earn a living practicing peer support, but being able to support peer-led organizations from reimbursements for the services we provide. What if we didn't need to rely on grants? What would it look like if we could fund ourselves? At one point, we even discussed the idea of being licensed through the Department of Public Health as counselors, as opposed to only having a certification recognized by DEMAS. By the time 2019 rolled around, someone on the Insurance and Real Estate Committee was listening. In that legislative session, House Bill 5270 was introduced, an act concerning peer support specialists and requiring health insurance coverage for outpatient peer support services provided by certified peer support specialists. This bill would require insurance coverage for outpatient care provided by certified peer support specialists. It would also outline the licensing procedure to make it legally official. The executive director of the Connecticut Legal Rights Project testified in support of this bill because it would create a new type of parity between services provided in the public and private insurance plans. While this bill was far from perfect, it did look like we were finally starting to move forward towards unlocking the full potential of what peer support could offer our state. This was the first and last time a truly professional licensure would have been enshrined in state statute for the practice of peer support. By 2020, we had asked so many questions around reimbursement for peer-driven services, we needed a group of dedicated people to sit down and figure out our options. House Bill 5248, an act establishing a task force to study health insurance coverage for peer support services in this state. Even though there was very little in the way of opposition, it failed to pass. Refusing to give up, peer advocates approached their local representatives and asked them to try again. The second incarnation of the task force bill came in the form of HB 5550. The purpose was much more clearly defined: to establish a task force to study the possible certification and education of peer support specialists in this state. The peer support services that would be delivered by such certified peer support specialists and possible health insurance coverage for such services. During the 2021 legislative session, this bill was merged into HB 6588, which addressed multiple mental health and addiction service topics. After a short time, it merged with other House bills to create the much larger Senate Bill SB 1, which was voted into law. Even though our small section talking about the task force seemed lost among its many pages, we remained hopeful. By the end of summer 2021, notifications were sent out to those selected to serve on the task force. We watched as peers got excited on social media and waited for the announcement for the first meeting. Then we waited some more. The holidays came and we rang in the new year. Still nothing. Months went by. On January 1st, 2023, an article was published by Marky Fitch, a reporter for the Connecticut Inside Investigator. The title? Failure to Launch: The Mental Health Task Force That Never Happened. In spite of protests that the task force never happened, DEMAS and Yale Perch moved forward. They started to formulate a plan to create new standards for peer support training and certification. An announcement was made that any peer interested could apply to have a seat at the table. 2 groups were to be formed: a subject matter expert panel and a peer advisory committee. Applicants received an email on March 23, 2022, stating that the selections had been made. What followed was months of confusion. It was hard to keep things straight for the peer groups, as things changed constantly. At the end of the ordeal, the DEMAS Office of Community Recovery Affairs hosted a couple of town hall meetings to explain the grandparenting process into the new certification. During those meetings, only 2 peers from the Peer Advisory Committee were present. The others, perhaps discouraged by the outcome, stepped away. After the meetings, dates and instructions for taking the test were distributed. Despite having 4 training organizations in the state, there is only one option for testing and certification: the Connecticut Certification Board, awarded a contract by DEMAS without a request for proposal being issued to bid on. So many problems arose with the testing process, and after a number of people complained, the testing was suspended indefinitely in mid-March 2025. Now, with most peer voices cut from the conversation, we learned that DEMAS, along with representatives from 3 of the training organizations, were meeting to discuss how to move forward. These meetings were not open to the public, nor were they recorded for future viewing. Once again, things were happening behind closed doors, with everyone wondering what was going on. What emerged is a completely new credential: the Certified Peer Support and Recovery Professional, or CPSRP. To so many people, it now feels like we are being rushed towards signing up for the next attempt at testing for this certification. Many of the concerns peers raised and some very important questions have been left unanswered. But we are being assured from people like Elsa Ward, Director of Recovery Community Affairs, that this is all being done so that we as peer specialists hold a more professional status in the mental health field. But will we actually be more professional? As a professional, one would assume that our credential would be transferable to other states. But the CPSRP will be unique to Connecticut. One might ask why DEMAS would not choose to adopt a nationally recognized peer credential, such as the Certified Peer Recovery Specialist, or CPRS. The answer to that question is simple. If Connecticut adopted a nationally recognized credential like the CPRS, we would be able to use another organization instead of the Connecticut Certification Board. In most matters, when we ask why something is happening, the logical thing to do is to follow the money. Since DEMAS does not want to answer some of our questions, let's ask AI. Is the Connecticut Certification Board operating in the red? Answer: according to its 2024 IRS Form 990 filing, the Connecticut Certification Board, CCB, operated in the red by a deficit of $38,000. In fiscal year 2024, its expenses exceeded its revenue. In recent years, the Connecticut Certification Board, CCB, has reportedly operated in the red, struggling to maintain financial viability. As a non-governmental 501c3 nonprofit, the CCB's financial difficulties have been a topic of concern within the recovery community. Details on the CCB's financial performance. In February 2025, an update on the CCB's finances claimed the board was consistently in the red, prompting financial restructuring efforts. Public financial filings for the CCB are available on nonprofit tracking sites like ProPublica and Candid. These reports are filed annually, so financial deficits may not be visible until after the close of the fiscal year. One strategy implemented to increase revenue involved charging fees for services that were once provided for free, such as the certification renewal for recovery support specialists. This change has generated controversy, with critics arguing that financial concerns have taken priority over the needs of the professionals being served. Another AI question: is the Connecticut Department of Mental Health and Addiction Services violating antitrust laws by forcing all peer support specialists to only use the Connecticut Certification Board to obtain their credential? In Connecticut, there are serious concerns about the legality and potential antitrust violations related to the Department of Mental Health and Addiction Services, effectively mandating the use of the Connecticut Certification Board for peer support certification. While the matter is not officially settled by a court, advocates have raised significant antitrust and monopoly allegations. The core antitrust concerns: no bid contract. DEMAS awarded the CCB the sole right to certify peer support specialists, reportedly without a formal request for proposal (RFP) process. Creation of a monopoly. By selecting only one provider, DEMAS essentially created a monopoly for the CCB in peer certification, stifling competition from other organizations. The CCB is not a state agency, and the lack of a competitive bidding process raises questions about unfair trade practices. Mandatory recertification through CCB. Under the new policy, peer specialists will be required to recertify and obtain the new Certified Peer Support and Recovery Professional, CPSRP, credential, which is only available through the CCB. Legal and historical context. Connecticut Antitrust Act. Connecticut has an antitrust act that prohibits monopolies and unfair restraints on trade. The state's Attorney General is responsible for enforcing this act. A private party could also sue for damages. Precedent for legal action. Advocates have already stated an intention to pursue legal action against DMAs, citing these antitrust concerns. Failed task force. In 2021, the General Assembly attempted to create a task force to examine peer services, but it failed to launch, leading DMAs to develop the certification process on its own. Conclusion. While a court has not yet ruled on the issue, the arrangement between DMAs and the CCB has led to credible allegations of antitrust violations. The process, which reportedly involved awarding a no-bid contract and creating a single mandatory certification channel, raises legal questions about fair competition. Advocates for peer support specialists argue the policy is monopolistic and could harm both workers and the peer recovery community in Connecticut.